In my opinion, the most important thing that's happened since 2008 and a little bit before that is the expansion of the clinical phenotype of prion disease. Now, in science, the word phenotype basically means appearance. And in the clinical world, it means what the patient looks like, but it also can refer to what a patient's brain looks like underneath the microscope. And this is where Dr. Gambetti played a huge role. So, as you know, sporadic Creutzfeldt-Jakob disease is the most common cause of prion disease. It makes up about 85% of all cases. But as many of you are aware, there are several different subtypes of sporadic CJD that look different clinically, neuropathologically. Sometimes the diagnostic tests will be different depending on the subtype. And basically, the subtype is denoted by a polymorphism or a certain code at the position 129 of the prion protein gene that we all have. We all have normal variants. You can either be MM, MV, or VV. And then we combine that with the prion protein type, which is basically demarcated by size on what we call a Western blot. And these are called, at least in Dr. Gambetti's classification system, type 1 or type 2. So for sporadic CJD, we combine that codon 129 polymorphism with the prion protein type, and we come up with a subtype that sounds like MM1, MM2, VV1, MV2, and so forth. Really has done a lot for the field and has really helped us learn a lot about prion disease in general. Now, of course, genetic prion diseases can look quite different. There are 3 genetic prion diseases, actually 4 now, but one of them is relatively rare, so I'm not going to talk about it. The most common is genetic CJD. That's pretty simple because it's named after CJD because it looks like CJD, so that's fairly straightforward. However, there are 2 other named genetic prion diseases called fatal familial insomnia and Gershman-Straussler-Schenker syndrome that I would argue doesn't even really look like what we had classically termed as a prion disease or CJD. So part of the expansion of the clinical phenotype is recognizing these very important different looking genetic prion diseases. And of course, Dr. Gambetti was instrumental in describing fatal familial insomnia. But there are other sporadic prion diseases, and probably the next most common sporadic prion disease outside of sporadic CJD is something called variable protease sensitive prionopathy, which again does not really resemble the CJD phenotype. And this is also something that Dr. Gambetti did with colleagues shortly before he retired. And of course, phenotype is very important for finding new prion diseases, as I described above, but very important transmissible prion diseases. So variant CJD is prion disease due to eating meat contaminated with mad cow disease. And one of the ways that variant CJD was discovered is that Dr. Will and Ironside, through their surveillance system, basically discovered young cases that looked different clinically and neuropathologically. And they were able to demonstrate that this was a novel prion disease that was very important because it demonstrated that the population was at risk and that something needed to be done for surveillance, but also regarding exposing people to mad cow disease. So why is this phenotypic description so important? Well, you can only diagnose what you clinically suspect, right? So when you go to the emergency room with chest pain, one of the things the doctor is going to do is ask you specific questions about the chest pain. And they're trying to determine whether or not that chest pain is due to a heart attack, a pulled muscle, pneumonia, reflux. That helps guide their examination and also their diagnostic test process. The same is true for prion disease. So there has to be a recognition that it could be prion disease for that diagnostic pathway to be continued. As I said before, it also allows for the capture of genetic prion diseases that would have been missed otherwise if we only assumed that all genetic prion diseases looked like CJD. It also allows for the capture of zoonotic prion diseases, which are basically transmissible prion diseases from animals. In this case, it's variant CJD. Of course, this is going to also probably be very important to help discover whether or not chronic wasting disease, a prion disease of deer and elk, is transmissible to humans or not. And because of that, it's a crucial piece of finding new prion diseases. And I think it's going to be very important for clinical trials because, again, you have to be able to recognize and diagnose someone with a prion disease in order for them to be enrolled in a clinical trial. But there are very important differences in phenotypes that are also going to influence how a clinical trial is conducted and interpreted.